Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.
Hello and welcome everyone. Let's go ahead and let everyone into the Zoom room. I want to thank you all for joining us. My name is Ruth Ellen Sanchez and I am going to be the host today for Daily with Doc and Becca. And Daily with Doc and Becca is sponsored by dailywithdoc.com. And if you, sorry about my camera. If you were invited by anyone specific to come to our show, and please make sure that you get back with them as they will be your point of contact. Also, this program is not meant to diagnose, treat, cure, or prevent any diseases, nor does it promote any kind of financial specifications. So today we have Dr. Lisa Singletary here as a guest with us. And her bio, let me tell you a little bit about her because she's pretty fascinating in my opinion. So Dr. Lisa is a MD and she has a master's in public health. She's also a certified holistic health coach, is a board certified family physician and holistic health director who delights in simplifying complex health issues, health science to empower patients. After leaving her medical practice to care for her patients, her health suffered and she discovered firsthand the incredible power of hydration, detoxification, and complete nutrition when she lost over 100 pounds and got out of her wheelchair. Now she is known as the 100-pound weight loss specialist. Dr. Singletary combines her medical expertise with her research in holistic health to guide others on their wellness journeys. So I'm going to bring Dr. Lisa on the screen. And I am really looking forward to hearing everything that she has to say. Welcome, Dr. Lisa.
Thank you so much. It's so good to be here. I'm multitasking now, but really I'm glad to be here. So I just realized that there was a slide I meant to include that I didn't include, but I will get all the information in and I will share with everyone today my little topic, the secret life of bones. I love that we're talking about bones. And I learned things about bones that fascinated me. And I'm going to show you, you did say in my bio, I like to simplify the science. I'm going to show you some real medical grade illustrations today, but I'm hoping to keep it real simple and just so you understand the amazingness that that we are. So let's see if I can share my screen. It's happening.
Yep.
And we'll do it in full mode. There we go. So the secret life of bones, your body silent multitaskers. Did you know that your bones are more than just a framework for the rest of your body? They are living tissues and they adapt to the things that you do in your life, and they help to keep you strong and healthy when you help to keep them strong and healthy. Here's one fact that I just found fascinating, that our bones comprise 20% of our body. So between the bones and the muscular system, that's over 60% of your body. I just thought that was amazing. Which means it's important to know, how do your bones grow? And every single step matters. Bones are dynamic. They're not just fixed, right? That they grow and they respond to their environment. Here's another thing that I was surprised to find, that there are 6 types of bones. Now we're going to talk about the most common type, which is the long bone. So you have long bones in your arms, your legs, right? The other types of bones you'll find in like your skull and your ribs and things like that. But the long bones are the main topic today. So you know how kids, when they hurt themselves, or even if they break a bone, quote unquote, or they get a fracture, usually the bone doesn't go very far, like it doesn't get displaced, or they're very resilient, the bones of children, and that's because they're mostly cartilage, and cartilage is soft, like your ear lobe. You can feel the structure of your ears made of cartilage. But over time, that cartilage becomes calcified or mineralized, and then we grow into mature bones. But guess what? All the cells in those bones, they're still alive. And that's something you don't think about unless you're looking at the bones under a microscope. So your bones are very, very complex, and they have very unique cells and blood supply. So I'm showing you a typical long bone on the left, but also I want to bring your attention to the ends of the bone, and they have a very, very special role to play. So here's some of the cells that live in your bones, and you see how they have those long protruding tendrils. So they live in hard, I call it the bone condominium, right? So they have little apartments in the bone, but they extend out so that they can get nutrition and release their waste and whatnot. But it's amazing that they build this cavity around them in the mature hard bone. Okay, so secret number 2, how does your bone get stronger? Well, it gets stronger from 2 things. It gets stronger from the nutrition that you give it, but it also gets stronger from weight-bearing activities. When you move, especially if you're moving your body weight or lifting weights, that is very important because your bone responds to that movement by getting stronger. So strength or weight-bearing activities are very, very, very important, especially in the older years. Oh, did I go backwards? I think I went backwards. Here we go. Secret number 3. This is fascinating. How bones heal. So there are many different types of fractures. But guess what? That's proof positive that your bones are living tissue, that after a fracture, they can heal. And it's very important to know what kind of fracture you're dealing with, because different fractures deal in different heal in different ways. But you might have heard about stem cells. They've been in the news pretty much. And your stem cells are the cells that get active and they start making bone tissue when when a fracture happens, when the bone has to repair itself. So here are some pictures of different types of fractures, and you'll see some of them are still in line, and those are the fractures that we can cast. But some of them are, you can tell they're not in alignment. Some of them break through the skin. That's a whole nother type of fracture. Some of them have an angle. They're not broken straight across, but they're broken at an angle. And when that happens, when it's out of alignment or when it's at an angle, then you're looking at surgical repair. We call it ORIF, open reduction internal fixation, because your muscles are still attached to those bone fragments. And if you don't, those angled fractures, if you don't repair them surgically, your muscles are just pull the bones together. They'll slide on top of each other and you'll end up with a short limb. So thank the Lord for the trauma surgeons, because they're experts at this. But here's an amazing sequence of how fractures heal. Now, the fracture I'm showing you is a very simple fracture. So those fractures that were spiral and that were displaced, wow, they go through a lot more than this. But what I want to show you is that the bones have a covering around them called the periosteum. And the periosteum is amazing. It's like an internal Band-Aid. And so when the fracture happens, if the periosteum is still intact, it will just hold the blood, because a bone, when those blood vessels break, there's nothing to stop that bleeding. So bad bone fracture can be very, very devastating. But if it's just a fracture that your periosteum is still intact, wow. It's like I said, it's like an internal Band-Aid. It will cause pressure in the area and it will form a clot. And then the clot will start to turn into cartilage. The cartilage will calcify, and then you'll have a whole nother bone structure in that place. Amazing. Okay, something's not moving. Here we go. Let's see. Okay, so bonus secret, how your bones make blood. This is amazing. And again, we're looking mostly at the long bones, but there are 3 basic parts of the long bones. There's not going to be a quiz at the end of this. You don't have to remember these words. I just want you to see that in the long shaft of the bone, the diaphysis, there's an internal cavity. And that's like the blood superhighway or the blood vessel superhighway. But then at the ends of the bones, there are these very intricate structures. And that's the condominium, right? That's where all the little cells are living. And so they have to get their nourishment, and they get it from all those little blood vessels. So your bones are very, very vascular. Lots of blood flow going. But guess what? It's not just the blood flow that's going to the bone. There's blood actually coming from the bone, because your bone marrow is where your blood cells are made. And it to tell you how many blood cells you make with every heartbeat, it's amazing. Okay. And you don't just have your red blood cells made there, you also have your white blood cells made there, which are your immune cells. So if you don't have adequate blood flow to your bones, and if you don't have the raw materials that your bones need to grow and to heal and to restore, if you don't have all of the components needed for your blood, including your iron and your other minerals and your vitamins, you're going to suffer multiple areas in the body. So one of the dangers, or one of the yeah, I'll say dangers, one of the catastrophic events that can happen is if someone is bed bound for any period of time, really, because your muscles weaken when they're not challenged with your body weight, your bones weaken, your circulation is less vigorous, and that means your bone marrow is going to be less productive of the red cells and the white cells. So it is crucial to stay active. And that means so there are different kinds of exercise, right? There are exercises for cardio, and there are exercises that are stretching, warm to warm up and cool down. There are exercises for gaining strength, and that means bearing weight-bearing exercises. Now, it doesn't necessarily mean you have to have dumbbells or barbells or go to the gym. You can do weight-bearing exercise with your own body weight. The key is mixing up your exercise. So you're walking, you're stretching, but your weight-bearing is super important for your muscles, but also for your bones. And that means you'll have better balance, you'll be less prone to injury, and you'll have more vitality. All right, so here we go. This is the vicious cycle. When you're have bed rest, like I said, even for 24 hours, but not just the fact of not getting up out of bed, you start to lose muscle. And when you lose muscle, that decreases that tension on your bones. And when the bones kind of get sluggish and thinner, then your immune system is going to decrease. And that's like the worst time you need your immune system to go down. So how do we eat healthy for our bones? We need the whole package. So we need essential nutrients, and we need the lifestyle. We need our daily habits. But the nutrients, we need the minerals, the foundation. We need the vitamins. We need antioxidants. And I want to highlight particularly collagen, because collagen is one of the main building blocks of bones, of our whole bodies. That's a whole nother talk about all the 4 types of body tissues, but connective tissue is one of the types of body tissues, and collagen is a key component of connective tissue, including the bone. So how do we get all this great nutrition? Well, I actually have a step-by-step process when I think of creating a nutrition program or a supplement program for someone. And I call those my 5 steps to complete nutrition. And we need to nutrify deeply to get all of our cells all of the things that they need. So step number 1, we need to avoid the bad foods. What does that mean? Well, there are foods that cause inflammation in our bodies. So in the standard American diet, it's like eating a fork full of fire. You're just firing up the inflammation in your body. And, we don't want to do that. We want to avoid those things. And here's an easy tip to think about what should I eat? Protein and produce. Now, there are other things, but if you just keep that as a foundation, protein and produce, your body will thank you. Step number 2, there are 90 essential nutrients that we need every single day. There are multiple ways to get that nutrition, and I think the most convenient and the best way is our Healthy Body, our Longevity Healthy Body Start Packs. Step 3, we've talked about, I mentioned oxidative stress and needing antioxidants and anti-inflammatories. I can't overemphasize it enough. That is because our environment is hostile. We live in a hostile soup of toxic air, pollution, chemicals, electromagnetic overwhelm. There's so many things that we can't change. The diet is something we can change, but in our bodies, oxidative stress and inflammation is really part of being human. And our bodies naturally make antioxidants, but we get overwhelmed. And the lifestyles that we live now weren't exactly what our bodies were designed for. So step 3 is super important to help our bodies deal with the oxidative stress of everyday living, but the extra stress of the environment. Step number 4, you have to be kind to your gut. You've heard it said, you are what you eat. That is not true. You are what you absorb. And in order to absorb the nutrition, whether it's the nutrition that might be in your food or the nutrition that you are taking intentionally with supplements, your gut has to be healthy to absorb it. And so there are ways that we can help the gut. Step number 5, I call that wellness wonderland. I love step 5. I love all the steps, okay? I love all the steps. But step 5, if you've got cryotherapy, if you've got, what's that, red light, infrared therapy, and hey, you can go to those fancy places and get the fancy equipment, or you could just go out in the sun. Grounding, just walking barefoot on the earth. And then the targeted nutrition, joint support, brain support, bone support. Oh, that's joint. You can call it joint. um, thyroid support, uh, all of the wild and wonderful things that are in Wellness Wonderland, you can try, and they may be beneficial, but you won't get the maximum effect unless it's built on the foundation of the 4 first steps. So avoid the bad foods, get the 90 essential nutrients, get your antioxidants, your adaptogens, your anti-inflammatories, take care of your gut, and then have at it in Wellness Wonderland. All right. So in my studies about joint support ingredients, I actually researched what are the top researched natural ingredients for joint support. And I got a great list, and some of these things will be very, very familiar. Glucosamine, chondroitin, omega-3 fatty acids, turmeric, curcumin, collagen, boswellia, MSM, green tea extract. All of these have a benefit in joint support and bone health. Magnesium, SAMe, borage oil. And one of the things, we live in the world of AI. And so what I had the AI do was take my research and make a little podcast. So there's a link at the bottom of this page where you click on the link and you go right to the podcast and you hear these 2 AIs talking about all the research. I love it. And you might say, well, I can't click. If you're trying to click your phone right now, it's not going to happen. It's not going to work, right? But I will be providing you this document. So you can have my research, but also I made a comparison of multiple bone and joint supports that we have in longevity side by side. So we want to remember with our bones how amazing they are, how they affect multiple areas of our bodies. Particularly in my mind, a lot of times we don't think about the bones function in the immune system, but our immune cells come from our bone marrow. So your bones are amazing. They're amazing the way they grow, the way they get strengthened, the way they heal, and the way they make our blood cells and immune cells. So, ta-da! You can get this free guide, my 5 steps for joint support, and it's got pages. And it's a PowerPoint, but I think I turned it into a PDF. So you don't have to have PowerPoint. You can just download this. I don't need your name and address or anything. You just click on this. You'll go straight to the download page. You download it, and it's yours. You can also go to the link if you're on your phone or if you can't scan the QR code right now, go to drlisasingletary.online/5 steps for joint support. And please put some hyphens in there. So it's 5-steps-for-joint-support. And that might be my last slide in this presentation, but I would like to tell you a little bit about my story. So if I have a couple more minutes, I am Dr. Lisa Singletary. I am known as the 100-pound weight loss specialist because I personally lost over 150 pounds And in the process, I realized that there were 5 steps, not 5 steps, 5 M's. So I made this 5M framework of total transformation: mindset, macronutrients, micronutrients, motion, and measurement. And with those 5 M's, you can transform your life. Whatever your health goals are, whether they are to gain weight, lose weight, get more fit, get endurance, all the things. We work these 5 M's and we tailor them for you. So I am a board certified family physician, but I retired to go home and take care of my parents. I have a master's degree in public health, so I love educating communities and populations, and I love being a holistic health educator. And I'm passionate about empowering your transformation to achieve your health goals. Now, in 2006, I was a very, very heavy girl, but I had the gift of mobility. I had strong bones and muscles. And that really made all the difference, I believe, in my life back then. But in 2008, that's when I went home to take care of my parents. And that's when I stopped ballroom dancing and going to the gym and other things that I was doing just as part of my lifestyle. And after taking care of both of my parents for 8 years, I needed my father's wheelchair just to get around the house. I was in such pain. I was racked with inflammation. I needed a miracle. Now, in health and wellness, we don't talk about miracles, but this is my disclaimer slide. Now, I know we had a disclaimer earlier, but I also disclaim that I'm not giving health advice. No, I'm not giving medical advice. I am giving you some health tips that helped me. I'm not diagnosing, curing. Uh-oh, I looked like I was frozen there for a sec. Hope I'm back. I'm not diagnosing, curing, treating, the H word, healing any diseases. I'm just telling you, I needed a miracle. And when I turned 60, which was a few years ago now, I made this chart because I could remember my weights during times of my life. And I was really surprised when I saw the results because I was on this trajectory that they told us in the medical journals and in the wellness journals that people gain 1 to 3 pounds every year, usually in the wintertime. And I gained, but then I was on a yo-yo up, right? I'd gain, then I'd lose a little, but then I'd gain back more, lose a little, gain back more. And there was this brief period of time where I took a weight loss drug that I got some weight loss. I got some side effects. I stopped it, and it's just like I didn't have even that weight loss at all. I was back on the same trajectory. But something happened in 2015. That's when I learned how to nourish deeply my cells, the cells of my body and the cells of my gut microbiome. And because of that, I was able to go from the picture on the left to the picture on the right to my continuing journey today. So I want to thank you all for giving me your ear for this little bit of time. I hope you've gotten some value from what I have to share. And I think we have a little time for some Q&A. So, Ruth
Excellent.
Ellen, take it away.
That was absolutely amazing. I didn't know the bones did all of that. And how quickly they made blood either. That's amazing. Thank you so much.
You're very
So
welcome.
you have a question from AJ, so I'm going to bring AJ on and he can ask your question. And I'm hoping other people raise their hands to ask questions. All right, AJ, would you like to unmute yourself, please?
Dr. Singletary, let me get something straight. You said you were a medical doctor
Mhm. Yes.
and you didn't know how to nutrify your body, and I need to understand because I don't understand what you mean there. That sounds like an oxymoron. Please explain what you said.
Okay. So my medical education made me an expert at disease. It didn't make me an expert at health and wellness. In those 4 years of medical school, I had 2 hours of nutrition out of, like I said, out of 4 years. And in those 2 hours, the only thing I remember is there are 6 grams of protein in an egg. That's the only useful advice I got out of it. And at the time, I was like, well, we're in America. We don't need to know that there's 6 grams of protein in an egg, or how much, how the tables have turned, right? So I'm thanks to Dr. Wallach and the longevity community, I'm learning about the value of the uh, healthy carbohydrates, fats, and proteins. But yeah, 2 hours. That was it.
2 hours is more than I've heard that some others get. That's actually pretty impressive. So, what types of things do you find your clients now that you're helping them with? What types of things that do people decide? What makes them decide to come to you for help? Like, what are they dealing with that they say, you know what, I gotta give what Dr. Lisa is saying a try.
I think the number one thing is midlife weight gain. Like, weight hits different when you're young. And when you're young, when you lose weight, it's possible, to you gain weight. The yo-yo diet, the yo-yo thing that I was on, it hits different when you hit a certain age. And a lot of that is a hormonal shift. So stubborn weight gain is the number one reason people come. I would say number two is diabetes and uh, pre-diabetes, so metabolic syndrome. In fact, I've written a little ebook about metabolic syndrome in millennials because 20% of millennials already today have metabolic syndrome, 40% of adults. So it's a huge, huge problem. Now they don't know, right? The young kids, they don't know that they have it. But and so to reach them is not easy. But I think about my own nieces and nephews and their kids, and I really, really want to get this message of being healthy to them. So
just one last comment then. So when you're helping someone reverse their metabolic syndrome, do you make them stop drinking Coca-Cola?
yeah,
Is that required?
okay. Yes, because when you are on that, I love this word trajectory. It's not always easy to say when you're on a mic, but you're on a trajectory where your body is not handling those refined carbohydrates, the sugar, right? Your body's not handling it. And so there are people theoretically that uh, can handle a limited amount of carbonated beverages, but they should not be taken with food, right? So to eat a meal and then douse down, a can of Coke, that is exactly the wrong thing to do. For those that
5.
can handle it, wait a
Why?
couple hours and maybe 6 ounces, not 16.
Why is that the wrong thing to do? I'm sorry.
Stomach acid, um, the it, the number one reason is the effect that it has on the cells of your stomach, and that's part of your metabolism. That's part of breaking down those things that you eat. Most of us aren't chewing enough, and so we get these big food particles. Most of us don't have stomach acid that's strong enough because we're avoiding salt and stuff. And those particles that are not completely digested in the stomach get into our intestines and start trying to punch through. It's like, look, I'm trying to get in the body, and the body's not letting it. And so they'll punch through and cause, I'm being very figurative here, but it can cause a leaky gut situation. So very important. Every step is important.
Yes.
Thank you for explaining that.
Thank you for your question, AJ. And just elaborate a little bit of why salt is so important for your stomach acid and being able to digest your food. Because a lot of people are put on low salt diets or no salt diets, and they get sicker and sicker and sicker, and they don't understand why.
Yeah. So, and AJ, I did not completely give you the whole story about sugar, but wow, there is so much evidence about what sugar does hormonally, what sugar does in our cells, what sugar does to pull water out of our system so it dehydrates us. There are just so many things that it does. So I'm just giving you a little piece. But salt, hydrochloric acid is stomach acid, straight up. And the chloric part comes from salt, the chlorine. So we need that component, the hydrochloric acid, in order for our cells to be able to make the strong acid. And we need the strong acid to break down the protein fibers and the all of the macronutrients that we take in. There's a whole process to get from an egg omelet, let's say, right? Or whatever, you choose it, but I like eggs. From the egg that you eat into your cell, or a piece of steak, or a cheeseburger, or a piece of fish, or anything that you eat. When you eat those nutrients, your cells can't use them, right? You have to break them down. And I liken it to trying to go into a laundromat. This has happened to me. And using those quarter machines, but you don't have any quarters. All you have is a $20 bill, right? You need to go to the change machine to get the quarters. Now you've got a currency that the cells can use, a currency that the machines can use. Your $20 bill is no good in the laundromat unless you change it. So the foods that you eat are no good to the cells of your body unless they're changed. They have to break them down into units that your cells can use. That's metabolism. And metabolism starts when you're chewing and all the way down to absorbing through the gut lining into your bloodstream and then to your cells.
I love that analogy because that makes sense. That makes a lot of sense. And I'm going to use that. I'm going to use that. And I'm guilty too, with like being in a rush and not chewing my food all the way and different things. And it just it's not good. We need to make sure to chew and to, I mean, I have a salt shaker on my desk. So if I eat at my desk, I can salt my food if it's not salty.
And this is why. Um, I've talked about proteins, and proteins are the structural and functional components that do so much in our bodies. And proteins have a particular three-dimensional structure. They fit like a hand fits in a glove. And when that fit happens, like on an enzyme or a hormone on a cell or a protein, when these three-dimensional, microscopic three-dimensional structures fit in the right place on the right receptors, they trigger things to happen inside of our cells that we need to happen. And when it's the wrong structure and it's trying to wake up a cell, it's trying to say, here I am, I want to do something into the cell, and the cell's like, oh no, you don't belong here. It will alert your immune system and say, we've got an intruder, get this thing out of here. Okay. Well, when you have tiny bits of food particles that are not completely digested, or they're not broken down enough, that make their way across a leaky gut into your bloodstream, your body doesn't recognize it, or it recognizes it as an enemy.
Mhm.
And that triggers what I was taught was an autoimmune disease. But a lot of times, the basis of these autoimmune diseases is you didn't chew your food right, or your stomach acid wasn't strong enough. You have a leaky gut, and the food is getting across in a too large a state. And it tricks your immune system into thinking it's not supposed to be there, and puts it at high alert, and they go and attack. But sometimes those particles trick the immune system into attacking your body, because they can be similar. The proteins might be a little similar to your body's proteins. And so the antibodies are like, oh, well, that was a bad guy. This one looks like that bad guy. Let's attack that too. So your immune system is designed to attack foreign invaders, but when the foreign invaders come in looking like you, then it attacks you.
That is fascinating and makes so much sense. Like, that makes so much sense. Thank you for that.
You're welcome.
So we do have Florence who has her hand up. So Florence, if you can unmute and you can ask Dr. Lisa your question.
It's not a question. I am just so amazed that of the explanations we're having. I have been diagnosed with autoimmune hepatitis since 2021. And it's just recently that I got any idea or information as to how to get healed, because all I was getting was prednisone, because the number in my liver enzymes was showing in the thousands when they're supposed to be 30s and whatever. And none of the doctors, not the hepatologists, I saw two of them, not my family doctor, nobody ever said in those 4 years, oh, your nutrition. They never addressed my nutrition, period. All they have been doing is trying to keep those numbers down. That's one. And two, to they said, suppress my immune system.
Oh, yeah.
And it's just recently that I came to realize that nutrition that I was taking was not being observed. I went from being a person who can normally be in the 50s and begging my body not to get there. I went down to 117 pounds just because nutrition was not being observed. I was eating, I was even taking some of the, certain other healthy stuff, but my gut needed healing. And this, when I realized that, and the doctor that I'm seeing, she started giving me a protocol, and this is what has turned things around. I mean, it has turned things around so much that I didn't have to take those nasty prednisone killers. I didn't have to take any of that. And the doctors think that it's that medicine that is healing my liver. But no, it is being on a healthy protocol from longevity and my gut being healed. And I'm saying that the doctors that were dealing with me do not even know what they don't know.
Yeah.
I mean, they're doing their best, but they don't know what they don't know. My mission right now is to educate, because I feel the whole process that have been going through is not for me, but my healing and everything is to be shared. And I am educating myself. And this was like university class that I've been in this afternoon. I am so, so grateful. Ooh,
Florence, thank you so much. Thank you. And that is amazing. I just want to say this one thing about prednisone. We used to say, and this was true, for a few days, prednisone, and the same goes for painkillers, the narcotic painkillers or very powerful painkillers. For a few days, for a short period of time, they can be gold. But you go more than a week and it's poison. Now, for some people, of course, they can't take any painkiller. Please take that off the table. But just the point that, yeah, there's a place and a time for allopathic medicine, particularly in the emergency or trauma arena. But the prednisone, oh my goodness, do try to avoid it.
Yes.
That's all I'm saying. Because
Mhm.
it suppresses your immune system. You need your immune system, right? And it starts a cycle of deterioration and disintegration in your body, in your joints, in your metabolism. It's just shivering how bad it could be. So, but
Yes.
but yeah, that was an amazing, amazing testimony. Thank you for that.
It was great, Florence. Thank you so much for sharing that. And that was powerful, very powerful. Thank you. Yeah, my aunt was on prednisone because she had severe asthma and it destroyed her body. And she knew it's what was destroying her body, but she was able to breathe and then she wasn't. It was really a sad thing. Yeah. Yes. And it is necessary sometimes for a short period of time. It can work, but like you said, after a week, forget it.
But guess what?
Like,
stop eating bread.
Yes.
Hello. Hello. Like, no, people would rather get a prescription for something than change their pantry or change their diary or diet. So.
I had to change mine completely. Completely. I was very sick at one time and I weighed 235 pounds, actually over that. And I was willing to change my diet and start supplementing. And I lost a lot of weight and I felt better. So I'm very grateful for that. So AJ, you have another question and then we're going to go to Donna.
My question was just real quick. What was the biggest thing that when you entered the nutrition world, the biggest thing that you learned from Dr. Wallach's teaching?
That overweight, obesity, and morbid obesity, which was my state, or they call it the super obese, that is a disease of being overfed but undernourished. So being able to approach the weight loss journey from a point of abundance, of, again, giving your body what it needs, then the body knows what to do. And the body can, so my particular journey, that drop on my weight chart came from one product, BTT. I started with 7 scoops a day. That was a lot. But number one, it was the only product I knew. Number two, I'd heard it's something about being dosed per body weight. I was over 400 pounds and I figured I needed it. Now, guess what? My body told me, and I can't even tell you exactly how, but my body told me when I needed to cut back. It was like, this is too much. I can't even tell you. Maybe it was a taste, because your tongue is like a chemical factory. And so sometimes you taste things and you know that it's not right for you. So I cut back and I cut back. But within 8 months, I went from, well, let me not say, in 8 months, I lost 85 pounds and got out of the wheelchair. But before the 8 months, just within a few weeks, I had a whole different relationship with food. And by that, I mean, if I had to, let's say, go to a store and let's say a Best Buy, because I was into K-cups before I knew about longevity, but I had a K-cup machine, a Keurig machine. And so I go to this Best Buy, and I was in the country. And so Best Buys were like 40 minutes away, something like that. And I planned my route based on which fast food joints were on the way, right? That was the number one decision I made. And if I was distracted and I missed the turn for Chick-fil-A, let's say, I would drive 3 miles to the U-turn, to the opening, make the U-turn, go back, right? And one day, I'll say about 3 weeks after I started the BTT, I did nothing else. I didn't change my diet or anything. But I was driving home and I passed the turn for the Chick-fil-A and I said to myself, "Oh, I've got food at home. I'll just eat there." And I opened my eyes. I mean, I was driving, but so my eyes were open, but they opened more. I was like, "Who am I? What happened?" That never happened. I mean, it's a very simple thing, but I got stories about fast food joints. I made up a disorder called Nisrati syndrome. That's NSRATI, Nisrati syndrome. That's not so random acts of temporary insanity. And I'll give you one. I tried keto once before nutrition. And so, Wendy's. Wendy's had a chicken Caesar salad and the croutons were cheese instead of bread. So if you ordered it grilled, not fried, but grilled chicken Caesar salad and unsweet tea, that was the perfect drive-through keto-friendly order, right? So one day I'm driving through and I that's my plan. That's my order. Get up to the window to pay the money. And she's like, oh, you got the number one with a Coke? I'm like, um, and I had to run back the tape. Like, did that really come out of my mouth? But I had Miss Roddy's. I was temporarily insane, memory lapse, and the whole thing. So your cells, your gut microbiome will make you do stuff that you don't even want to do.
Yes, it does. That is so funny. ZZ Captain from YouTube is saying thank you, and then orange cat whistling is that emoji. Apparently, he said thank you so much. And I have suffered from Nascarati syndrome before too, and it is absolutely temporary insanity. All right, so let's go to Donna, and then we have one more. So I'm going to ask you to unmute, Donna. Do you have a hard stop? I forgot to ask before we started.
I'm flexible.
Thank you so much. Okay, Donna, go ahead.
Well, thank you, Miss Lisa. I appreciate that you have give us so much knowledge. So far, this past 2 weeks, I've been visiting my family, and guess what? Everybody has a knee pain.
Mm.
When you touched on, I was wondering what caused that knee pain. All it's like all my cousins, they're like in 30s, 40s, 50s, 60s. Some they have operations, hip replacement, and you said give up bread. We're Polish. We don't give up bread. Bread is our food. So I try to explain some things to them, but bread is one thing is not easy to give up for us. But your information today had brought lots of light on how the bones can help us be healthy. Because I've been on Dr. Wallach's protocol, and I feel fantastic. Comparing to it, I hear from everybody and trying to help them out. They just, don't want to listen. But I appreciate you very much, and I want to thank you for sharing all you do. And as a weight loss, I'm going to talk to my sons. They need to lose some weight, but you will be a great inspiration to them. Thank you.
Dziękuję.
Oh, proszę bardzo. You speaking Polish too?
That's all I know.
That's all you know? All right. Thank you. Thank you so much. I appreciate you.
Thank you, Donna. That was awesome. Thank you. All
You gonna
right.
answer the question?
Excuse me? Oh, what causes knee pain? So here's the thing about synovial joints. And that is a synovial joint. Just think of it as your joints that just move in one direction. So, and they have cartilage. So, but there's a little bit of joint fluid to decrease the friction in the cartilage. Well, the joint fluid also has to do something else. And that is, there's something special about cartilage as opposed to bone. You saw that the bone has a lot of blood vessels. Cartilage is, the scientific word is avascular, but what it means is it doesn't have blood vessels. So the only way your cartilage, your chondrocytes, your cartilage cells, and they're the cells that maintain that cartilage, the only way they get nutrition and get rid of waste is through that synovial fluid, that little bit of fluid. And that's what they depend on for their nutrition, for their hydration. And so when we're not drinking enough, and when we're eating toxins, and when we have, I got to give it up to pharmacist Ben, dirty blood, then our synovial fluid is a toxic place for our cartilage. And not just because, I mean, it's designed to bear weight, right? It's designed to carry us, but if we're not giving it the right nutrition, the right nutrients, and we're not hydrating properly, we're not detoxing properly, then the joints become a toxic place. And depending on what you're eating, the toxins that build up could be uric acid, and people will start getting gout, or they could be, just other things. So I just can't tell people enough. Follow the good food, bad food list. Hydrate properly, and most of my hydration is with Longevity's functional hydration. That and give up the bread, give it up, give up the wheat, barley, rye. Now I'll tell you, my oatmeal, that was the last thing that came from the clutches of my fingers when I was purging my kitchen. It took, when I really decided to follow the good food, bad food list, and I was like, not my oatmeal. So I had the grip. I had the grip on Quaker Oats guy, but eventually I let it go because I could feel it.
Mhm.
I could feel when I ate a bowl of oatmeal, an hour later, 2 hours later, I was bloated. I was gassy. No, I didn't say that. I had inflammation, right? I could feel it. And I didn't want it to be the Quaker Oats guy. Was that William Penn? I didn't want it to be William Penn. But I had to let Bill go.
Yes, I know that feeling. That's amazing. Thank you. All right, let's go to Yvonne. You are amazing, Dr. Lisa. I love you. I can't wait till you're on again. I cannot wait. Yvonne?
Hey, thanks for having me. Good afternoon, everyone.
Hey.
I loved your story about, the Chick-fil-A, the Wendy's, and of course, just loading yourself up with all that BTT. As a certified amino acid therapist, I will tell you, you were getting those amino acids finally from your belly, I believe, to the brain, so that you could, come out of that psychotic state you thought you were in.
Misrati syndrome. Not so random acts of temporary insanity. Yeah.
Yes. Very, very good. And, I love that this product line offers very, very few product lines will actually put amino acids in their nutritional sources.
Mhm.
But we do know the very foods that create cravings are also the very foods that hinder our mood or change our mood. And you were, improving what you were doing. You were taking the bad stuff out, adding in more amino acids, whether you recognized it or not. And, the mood food cure is, it's a real thing. And so for cravings, I love to hear what you were talking about, because that's like seeing it in action. Obviously, a lot of times I'm talking about doing some concentrated amounts of amino acid, but yeah, you saw it happen. What did you say? Like within 3 weeks?
Mhm.
Yep. Love it.
And again,
thank you so much for sharing.
Thank you, Yvonne. No conscious change on my part, other than taking in the good stuff.
Yes. Yeah. And you are taking in enough.
Yeah.
Enough. That's a huge key right there, right? Thank you so very much again, just for sharing, because you're shedding light for so many others, or bringing hope.
Thank you.
Appreciate you.
Thank you.
And
Thank
you're amazing.
Thanks.
Here she is. Thank you, Yvonne. All right. And you have time for one more,
Absolutely.
Marilyn? All right. Marilyn, if you can unmute yourself.
Yes. You had mentioned that the long bones form new cells or stem cells. What do you think about stem cell therapy then to repair the bones?
I've heard good things. I think it's very, it's prohibitively expensive for a lot of people. A bottle of ZRadical is a lot less because ZRadical stimulates stem cells. And I just think many of the things that we do, that we have in our line, just like Yvonne said, I wasn't aware about the amino acids. We're not aware about our stem cell generation power in our supplements, but that's what they do. So it takes longer, right? But and also if you do have benefits from something like stem cell therapy and you're not changing your diet and you're not getting the 90, you're not really taking care of the foundation of the problem. But like I said, I've heard good things.
Nothing detrimental, like there could be too much proliferation of too many cells, or
the most detrimental thing is going to be to your pocketbook.
Okay. All right. Thank you.
But your body is smart. The body is very smart. So if you're willing and able to go through it, then have at it. But do all the basics first.
Okay, thank you. Appreciate it.
Thank you, Marilyn. And
Coach Rod.
Yep, Coach Rod. I don't know if you can turn your camera on, Coach Rod, but that would be awesome. All right. There he is. And
all right, can you hear me?
Yes,
loud
very
and clear.
good today.
How you like that? How you like that? I just have to tell Dr. Lisa thank you, but she is definitely a great representative of what we have going on. But it's more certification and verification when you get a licensed doctor to be such an advocate for natural health. But I also want to say that on occasions, I think we only met once if we met, but every time I needed help, Dr. Lisa reached out and send me information. She sent me all kind of information. She sent me videos. She sent me spreadsheets, whatever I need to help me at the time. And a couple times I needed some help on some things, and she always comes through. And she always send me new stuff or did you know? So I just want to know that she's a real advocate for natural health, even being a doctor. That she's really about this life and she's not just coming along trying to make money or whatever, but she really, really want to make people better. And I thank her for helping me. Even when we haven't seen each other in years, she always there, even up to what was that? Like a month ago, maybe. Dr. Lisa, we talked, but yeah, just recently. But we're always there, and she always there. It's such a great thing to have family and longevity that you can go cross line to help you. So thank you so much.
It's an honor, Coach Rod. Happy birthday.
Yes.
Thank you, thank you, thank you.
And I just love your rise as well. And our discussion will continue that we had because we're doing things. We're doing things. Thank you, Coach.
Thank you so much, Coach Rod. That was awesome. Yes, happy birthday. All righty. Thank you so much, Dr. Lisa. This was amazing. I really enjoyed your talk, your slides. We got a lot of compliments on your slides and your presentation because the graphics were amazing. First of all, because people don't they'll show the bone, it was so detailed that it really kind of made you think well, for me specifically, it made me think I didn't even know, you don't understand the structure of the body unless somebody shows it to you like that. So thank you for that. And thank you so much for being on the show. I am looking forward to you coming back. I would love that. I know that everybody would love it because you're awesome. You're amazing. So, all right. So we are running a little late. So if I could get my co-host to join us on the screen and close out the show. So again, thank you, Dr. Lisa. And we have Coach Rod, who, happy birthday, Coach Rod, is also helping us out there on the different platforms and helping Albert let people in when necessary. And he's an amazing person, and just so happy it's your birthday today. Have fun. He is the motivator. And then we have Albert, who is from South Africa and he is the warden and lets people in the meeting and just does a lot of things. And he's a true gentleman. He's a true gentleman. And thank you for joining him, Marty. It just amazes me that he has zebras and giraffes and things walking through his property. It's like, I love it. I love it. Although the lions and tigers, it's a little scary. And then we have Marilyn, who is doing dictation and typing. We call her Miss Speedy Fingers, and she brings a phenomenal gift to us all. For those of you that join us in Zoom, you can take pictures of the different things that she says, that she types, that our guests have said, so that you can refer back to it later. So thank you so much for that, Marilyn. And then we have AJ, who is our digital marketing director, and he helps with so many things that there's too many to list. So thank you so much, AJ. And also we want to give a shout out to Phyllis, who had to leave, and she is a phenomenal benefit to our show as well as a co-host and just a person. And she is a reason, her and her husband are part of the reason that you heard Dr. Wallach on the radio. They helped get him started in radio and helped get his message out. So thank you so much, Phyllis. And of course, our Rebecca Dukes, who is traveling across country right now. We love you, and we hope you arrive safely to your destination. And thank you for joining us for a little while on on YouTube. So thank you for that. My name is Ruth Ellen Sanchez. I'm the executive production manager for Daily with Doc and Becca. And I'm just grateful to be part of this journey as well. And if somebody referred you to this program, please make sure to get back with them, and because they are your first point of contact. And then Dr. Lisa, I believe we put your information in the chat and on YouTube, but if you would like to say it again, the link to get to you, if anybody would like a consultation with you or anything.
Okay, to me, it's Dr. Lisa Singletary .online / 15 minutes.
Okay, perfect. And it's DR, right? Instead of
DRLIS. Yeah, Dr.
Okay,
Lisa
perfect.
Singletary .online / 15 minutes.
Okay, thank you so much. Also, we do have a call team that is waiting to take your calls, and Albert is part of that call team. So when we're sleeping, he's answering because he's like 9 or 10 o'clock at night, right? Rebecca, I should know by now. And so the call team number is 855-949-3377. And if you have any questions, it's questions@dailywithdoc.com. And if you want to watch the replay of today's show, it'll be available all weekend or until next Wednesday when we do our next show. It is live.dailywithdoc.com. And you can watch Dr. Lisa all the way until next Wednesday by going to that link, or you can visit us on our Critical Health News YouTube channel and Rumble channel as well. And then, did I miss anything, AJ? No. Okay. All right. Thank you again, Dr. Lisa. It was amazing to have you here. Everyone, have a beautiful weekend and a beautiful beginning of your next week. And we will see you next Wednesday. Take care and have a great day, everyone. Thank you so much.
Thank you.
Thank you.
Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.